To calm the storms of psychiatric disorders, there are a number of effective medications available. This program will focus on the use of antipsychotic and antidepressant medications and side effects. These are the most commonly used medications with older adults experiencing the symptoms of dementia or depression. This program is designed to help you better understand the need and appropriate use of these medications, and especially to help you become aware of the side effects associated with them. Dr. Tim Egan discusses treatment of dementia symptoms using medications.
Since there are no good medications at this point for reversal of the process of dementia, after nursing interventions are exhausted, basically one's left with the option of trying to treat those symptoms that are most troubling with medications. Sometimes this can involve the use of benzodiazepines or anti-anxiety medications. Sometimes it'll involve the use of non-benzodiazepine anti-anxiety medications. Sometimes it might involve the use of antidepressant medications, anticonvulsants, or other types of medications that are used in general psychiatric practice. In general, using antipsychotics and other medications in the elderly population, there are some rules of thumb that appear to be fairly safe to follow. The elderly patients appear to be more sensitive to drugs because of their increased age, and it's probably related to aging changes in the central nervous system. In general, lower doses can be used with the adult population, and it's clear that agitation can be managed with neuroleptics, but that other non-neuroleptic strategies have been proposed, including the use of antidepressants, benzodiazepines, and non-benzodiazepine anti-anxiety medications. The antipsychotic medications are listed in the graphic, and basically are organized on a basis of high potency drugs to low potency drugs. Those medications that are high potency medications require less milligrams in order to cause their effect. Those that are referred to as low potency medications require a great deal, many more milligrams in order to be effective. And where this becomes an issue is in the types of side effects that both types of drugs exhibit. The low potency drugs, in other words, those that require a higher number of milligrams to be effective, are medications such as Thorazine, Mellaril, Serentil, and the generic names are listed. They tend to cause a great deal of sedation. They may cause dry mouth and blurred vision. They may have a tendency to cause lowering of the blood pressure when a patient stands up from a lying position. They are less likely to cause muscle stiffness and the Parkinsonian type side effects that we had discussed earlier. On the other end of the spectrum are the high potency antipsychotic medications whose trade names are medications such as Haldol, Orap, Stelazine, Prolixin, Navain. Those medications require less milligrams to be effective and exert their antipsychotic effect, and are less likely to cause sedation, dry mouth, blurred vision, constipation, urinary retention, or orthostatic dizziness, that sense of becoming lightheaded when someone stands up after lying down. They are far more likely, however, to cause the Parkinsonian type side effects, muscle stiffness, thick tongue, tremors, and a syndrome referred to as akathisia, or restless legs, where a person feels as though they have to keep their legs moving almost in a marching fashion. Antipsychotic medications can cause a variety of extrapyramidal side effects. The acute side effects are dystonias, in which a person has a sustained, sometimes painful contracture of a muscle that they're not able to voluntarily stop. It may cause, they may also cause a condition known as torticollis, in which the head turns to the one side or the other and is held in a sustained position like that. That's often a painful, uncomfortable position for the patient to be in. And they also can exhibit something that's referred to as opisthotonus, or oculogyric crisis, in which the eyes can kind of roll back in the head and are hard for the patient to bring down voluntarily. And I think you can imagine how uncomfortable all those symptoms can be. They tend to occur right away, in the course of administration of these medications, and generally are fairly treatable by the use of anticholinergic medications. Some of the conditions and side effects that can occur with antipsychotics don't occur necessarily right away, but may take a few days to develop. And this would include the typical side effects of Parkinson's disease, where you have loss of associated movements, mask-like faces, drooling, and rigidity of the muscles, and also the condition referred to as akathisia, or the restless legs. The other ongoing risk for treating patients long-term with antipsychotic medications is the development of tardive dyskinesia, which is an involuntary muscular movements primarily of the mouth, but it can be generalized to other muscle groups as well. In this condition, patients will exhibit some lip smacking or chewing types of behaviors typically at the onset, and it's sometimes an irreversible condition.
Kathleen Schultz, certified psychiatric nurse consultant, demonstrates Parkinsonian, akathisia, and tardive dyskinesia side effects and interventions with the assistance of actors.
Dale, you look like you're having some difficulties. You feeling stiff? Yeah, looks like it. Can you just release your hand here? Just kind of let it go limp as much as you can. Let me move it. Yeah, your muscles feel really tight. It feels like you're having what we call cogwheeling in your muscles here. This is a side effect from your medication. And I'm going to get you another medication that's going to make you feel better. You'll feel looser. Dale here is demonstrating very typical signs of Parkinsonianism that's induced by psychotropic drugs. It's one of the side effects we commonly see. And as you see, looking at his faces, they're very flattened. When he speaks, you can tell he's got a tight jaw. His speech is mumbling. His jaw looks tight as he attempts to speak. His hands are typically in the position that we may see a patient demonstrate. They're extended slightly in front of him. His hands display the Parkinsonian tremor. Another arm position that might be noted is straight at the patient's side. As they walk, the normal movement of the arms is absent. And in his gait, his legs are quite rigidly held, and he doesn't pick his feet off the floor. He's got that typical Parkinsonian shuffle. Very much resembles natural occurring Parkinsonian disease. Any of the anti-Parkinsonian medications can be given to relieve some of these symptoms for the patient. Anne, you're looking really restless.
Oh, I just feel so restless.
You feel restless inside?
Inside, my feet just seem like they're just walking by themselves.
Are you able to sit?
No,
Okay.
no. I
And-
can't sit, I can't do anything.
Yeah, I can see this is really distressing for you. What Anne is demonstrating is akathisia, which is another one of the extrapyramidal side effects that we see with the use of psychotropic drugs. The patient is very, very, very restless. They're unable to sit comfortably. They're unable to tend to any task. They walk back and forth. When they're in a standing position, they will pace from foot to foot many times. As this continues, they become more and more distressed, and it's really important to give them some kind of relief. As you can see, it's pretty hard to differentiate this from the agitation of an agitation that is associated with depression or with a psychosis. So it's really important to know your patient as a baseline, so that when this restlessness occurs, you can recognize it and give the patient the relief they need. What Dale has just demonstrated is a real troubling side effect of antipsychotic drugs, and this is tardive dyskinesia. Tardive dyskinesia is particularly troubling because in many cases there is no way to reverse the symptoms. Older people, older adults, especially those with organic brain syndromes, are at high risk for developing tardive dyskinesia during their course of antipsychotic medication. As you can see, Dale has demonstrated the tongue thrusting and pursing of the lips that you frequently see. 56% of all patients will first demonstrate tardive dyskinesia symptoms in the tongue, face, lips, jaw. It is very important to monitor closely those patients who have a course of antipsychotic drug therapy.
In addition to the anticholinergic side effects such as dry mouth and blurred vision, and in addition to the extrapyramidal side effects, the Parkinsonian type side effects, there are other problems with the prescription of these antipsychotic medications. They can cause a fair amount of sedation. They can cause apathy and weight gain, and in unusual circumstances can cause a very dangerous condition known as a neuroleptic malignant syndrome. The neuroleptic malignant syndrome is an unusual condition which is potentially lethal in its outcome. Probably within the past 10 years to 15 years, the condition has been more readily recognized by people working in the mental health fields dealing with patients with antipsychotic medications. And the mortality rate has plummeted. Not very many patients die of this complication any longer, primarily because it's recognized more readily and more easily. Any of the antipsychotic medications can cause a neuroleptic malignant syndrome. The use of other medications such as lithium, antidepressants, or benzodiazepines may predispose to the development of neuroleptic malignant syndrome, and there is no definite agreement on how to diagnose the condition at this point, except that in general it involves the onset of some level of rigidity, fever, confusion, and some elevation of some laboratory values like the creatine phosphokinase, although that's not definitely a diagnostic of the condition. We talked a little bit now about the treatment strategies and how to approach the patients after they have been diagnosed as having a major depressive episode. There are lots of good options available for the psychiatrist, or for that matter the family physician who's treating depression in the elderly patients. The groups of antidepressants can basically be broken down into heterocyclic antidepressants, sometimes referred to as the older tricyclic type of antidepressants, monoamine oxidase inhibitors, selective serotonin reuptake inhibitors such as Prozac and Paxil and Zoloft, others that don't fit very well into any of those categories, and electroconvulsive therapy. The older antidepressant medications are listed. They have been very effective antidepressants. Their safety is well established, and they are used probably not as often as they used to be in the past because of some other alternatives that are available now, but are still very effective antidepressants. They have some common difficulties with side effects, which include things like dry mouth, blurred vision, constipation, urinary retention, orthostatic lightheadedness or orthostatic hypotension, increased appetite, weight gain, sedation. And basically, in selecting from this group of antidepressant, one wants to try to match the side effects to the particular patient profile. There's side effects you may want to take advantage of, or side effects you may want to avoid. If you have a patient who has a lot of trouble sleeping, the use of a sedating antidepressant as a single nighttime dose makes some sense, a medication like amitriptyline or imipramine. If you have a patient who has a lot of trouble with lightheadedness when they stand up already, and you want to use an antidepressant medication from this group, then a medication like nortriptyline or Pamelor might make more sense, since it's the least likely to cause that type of orthostatic lightheadedness.
What's happened?
I don't know. I was sitting here and I stood up and all of a sudden I got so dizzy. I don't know. And I grabbed onto this and it just flew away. And I got over here and otherwise I would have fallen. I don't know what's wrong.
Well, I'm
so
glad you
dizzy.
didn't. We just started you on some antidepressants this week, didn't we?
Yes.
Yes. I'd like to check your blood pressure. I'm going to come in and take your blood pressure while you're sitting, and then I'm going to have you stand and take it again. It is important that whenever we add a new drug with anticholinergic side effects or increase the dose of antidepressants, antipsychotics, benzodiazepines, sedatives, that we monitor the patient's blood pressure. We also need to instruct our patients about how they need to get up slowly, they need to take a few minutes to move their hands and feet, kind of give that blood pressure a chance to adjust to the new position before they get up and move in any direction any further.
The newer group of antidepressant medications, referred to as the selective serotonin reuptake inhibitors, are the group that include Prozac, Zoloft, Paxil, Luvox. And these are medications that appear to be good choices in a large elderly populations. And the reasons for that is there doesn't appear to be much of a tendency to cause the anticholinergic side effects that are troublesome to elderly patients. There's virtually no likelihood of causing orthostatic lightheadedness, which can cause falls and dizziness in the elderly population. In younger patients, there's much less of a tendency for increased appetite and weight gain, and so women are more likely to stick with the medication like this as opposed to some of the other antidepressant medications. And in general, they offer, with their fairly benign side effect profile, good options for use in the elderly population. Probably someplace in the range of 10 to 15% of the patients that take these newer antidepressant medications are going to experience some jitteriness, maybe some restless legs, a reduction in their appetite, perhaps some weight loss. So in general, they're pretty good medications. They don't cause a great deal of sedation and tend to be tolerated better by most patients than some of the older antidepressant medicines. Several other antidepressants have been introduced to the market that don't fit real well into any of the previously mentioned categories. Two that you may encounter would be venlafaxine or bupropion. The trade names are Effexor and Wellbutrin. You probably will see them a little less often prescribed in the elderly population, although Effexor at this point is a fairly popular drug amongst the family physicians. If patients fail one antidepressant trial, there are a variety of options that are available, including moving from one class of an antidepressant to another one, the addition of lithium or thyroid supplements, and then finally the use of electroconvulsive therapy.
This program has focused on the use of antipsychotic and antidepressant medications with older adults. Special emphasis has been placed on the identification of the most common side effects associated with these medications. It is important for everyone involved with an older adult taking medications to be aware of the type of medication and related side effects and to communicate the development of any of these to appropriate members of the treatment team.